Lovely to be here today, and I am thrilled to be able to moderate this important conversation on AI for system change and driving impact through innovation. It is a topic that is near and dear to my heart. I'm currently the CEO of Crisis TextLine, and I've been working at the intersection of nonprofit and for-profit technology and business systems for the last 25 years to find and amplify and accelerate models that can solve some of our greatest challenges at the size of the problem. And so it's one of the reasons I lead Crisis TextLine now. We leverage text and technology and AI to connect humans to humans. So that we can be there for each other in their greatest moments of emotional and mental health crisis and support each other to the other side. We support about 1.5 million conversations a year in the US and over 2 million a year through other partners in countries like Canada, UK, and Ireland, and we'll be expanding to Latin America very, very soon. I am thrilled to be able to lift up two amazing organizations and leaders today that for their careers have also been focused on problems at massive scale and importance for the world and how to leverage technology and AI to solve them. And we're hoping today to have a really rich conversation and to engage all of you that I know are interested in the same thing. How do we leverage every possible resource to help as many people's problem as possible and solve these massive systemic issues? So first, we have François Mark, and he is a champion for sustainability through ReUSE Revamp. And he has been leading the organization to transform discarded laptops into learning tools and fostering technology skills in communities. His organization is based in Mauritius, which is also near and dear to my heart when I was on the board for African Leadership University that has a campus there in Mauritius for many years. But he is a visionary leader behind AfriEDX, where he has been recognized by the African Union as a top 40 ed tech innovator, creating new career and education opportunities across Africa, and has been working in the technology space for social impact since the 90s. Beyond his ventures, Francois mentors entrepreneurs and explores sustainable technology and drives innovation for positive change. Looking very forward to hearing what Francois has to share today. And then we are honored to have Manuel Rosemberg, who's the CEO of Dena Care, an AI-driven platform enhancing healthcare training, support, and monitoring for caregivers across Latin America. Dena Care improves home-based care standards while helping governments and companies address the caregiver shortage, already supporting 15,000 caregivers in 8 countries. In partnership with the Inter-American Development Bank, they have piloted a program with the Mexico City government, showing potential to benefit 2 million caregivers and patients nationwide. He is a serial social entrepreneur and previously founded Paz Mental, Mexico's largest home care company. So with that, I am going to hand it over to Francois, and after both of them have a chance to present, we're going to open it up to Q&A and have a fireside chat, and then we will break out into breakout rooms. So take it away, Francois.
Do you hear me? Fantastic. So yeah, thank you very much, everyone. Welcome, everyone, on this call. Thank you for having me again. ReUSE Revamp was created during the 4D to solve a massive problem where we noticed there's a lot of e-waste around, especially laptops. During the COVID, we found that there was a lack of access to technology, as in laptops, where people are throwing away. We can switch to the next slide, please. And yes, so we have the world count, the worldcounts.com. So it's a live statistics where you can log in on the website. You will see that currently, as from today in 2025, we have 11 millions of e-waste, especially laptops. So it's around 1,000 laptops every single second. So just imagine how many e-waste we are creating with the advancement of AI technology and so on. There's huge. We are creating a more and more e-waste. So we are talking laptops for now, but there's can be PC, it can be mobile phones and so on. But every year we have a new version and so on. There's a lot of waste. Next slide, please. And so we are trying to see why it is important, because there's a lot of problem that these devices, if not properly recycled, they can cause a lot of damages and produce a lot of diseases and illness. So this is part of the problem also that we want to solve. Next slide, please. So at the same time with the COVID, we see that there's a common problem that we see with the war with Ukraine, and there's a limited supply where people are getting challenges to have access to devices, to repair, to get parts and so on. So we think that we need to make people to rethink how to reduce and to repair, to push people in more and more have the immediate active action in mind. Instead of buying new, try to repair. And then another thing that's happening, there's a lot of more compute power in the cloud. So people don't need to have superpower PCs now to work in the AI industry to create extraordinary thing and to reduce CO2. Next slide, please. So there's a lot of e-waste, but we are focusing on laptops because this can solve educational problem, work environment, and create opportunities in many, many ways while contributing to reduce e-waste, especially bringing access to democratize and make access to technology more affordable. It's not free, quote unquote. Next slide, please. Yeah. So as we are also a Google partner, but we use other technology like Microsoft and so on. But Google developed its own OS, which is very light. It's Linux based, that can run on these slow machine and make them run super fast. So these low-use laptop can be used to solve a lot of problems and create opportunities and make access to AI more affordable. Because you will see that in some countries or families, there's a lot of NGOs. They have challenges to have access to ordinary PC, but we are trying with this ecosystem that we're putting in place to solve this problem and to make technology more accessible and so on. Next slide, please. So around this program, we are putting in place a sort of together with one of the key partners, which is the US Embassy here based in Mauritius, Port Louis, put in place a workshop how to train youth on repair, upcycling, and personal and make upscale the community in terms of repairs. Because instead of buying new, sometimes in the laptop there's something very basic that is not working, and help them to learn how to repair it and so on to contribute. Next slide, please. Same thing, making the access to technologies, NGOs more affordable and so on. Next slide, please. Yeah, this is also create an economic impact also, because this ecosystem help to create more people having jobs, in terms of once they know how to repair, they can have their own stock to repair for others, and also create side business to resell parts for other schools, other communities, and so on. Next slide, please. Yeah, at the same time, it's creating a good positive impact on the environment, and reducing the footprint and so on. In terms of instead of buying new, when you buy a new, so you need to import. So it's not a big thing, but it's a small contribution where we are contribute to reduce the carbon footprint. Next slide, please. I think we are almost, yeah, almost done. So I try to keep my and the time and so yeah. Can we?
Thank you, Francois. So we'll come back afterwards and ask you some questions. Go for it,
Yeah.
Manuel.
Thank you. Hello, everyone. My name is Manuel Rosemberg. I'm based in Mexico, but really our scope is in Latin America. And I mean, if we can go to the next slide, because I think it's a good introduction to what we do. So Anna Care, Anna stands for Automated Nursing Assistant. But if you must know the truth, we had named the platform Anna way before we thought of what it meant. The first caregiver we worked with was called Anna, and she was so great that we decided if we could replicate her 1 billion times, this world will be a better place. So Anna platform is an attempt to replicate Anna caregiver. But what we've discovered over the past 10 years is that the caregivers represent the untapped solution to a global crisis. The crisis being the demographic change. The percentage of elders that are dependent throughout the world far exceeds the amount of certified and capable and paid and recognized caregivers. So what we've developed is a platform, a technological platform that trains, guides, supports, and connects caregivers so they can become a backbone of the healthcare system. Now, I'll explain a bit more what I mean by this. So, I mean, the first shocking truth is that in Latin America, at least, and I think this replicates throughout most of the developing world, maybe 90% of caregivers aren't even paid. They're usually a female member of the family expected to do very arduous, very demanding labor of caring for someone in the family. And because of, incredibly unjust cultural what shall I call it, injustices, they're not meant to be paid. And fortunately, we're seeing a trend to change this. Fortunately, the world is realizing that the caregiving is a necessary job. It's a job that provides incredible benefits to society, and I think attitudes are changing toward this. And with this change in caregiving being recognized as an essential service that demands to be paid, I think we're slowly coming to a point where this gender imbalance is slowly being remediated. Over the past 10 years, we're seeing that slowly more men are willing to take on caregiving jobs, especially if they're paid fairly. So we created a vision where we think that caregiving is transformed from an exhausting, invisible role into a journey of growth, empowerment, and connection. And although this is an informal estimate, it is based on empirical experience that we've had, that for every dollar that you invest in caregiving, and by investing in caregiving, we mean in training, supporting, creating an ecosystem that recognizes caregivers, there's $10 in value. And how do we measure the value? Avoided hospitalizations, avoided medical costs. So there are a lot of studies that prove that trained caregivers will reduce hospitalizations by up to 30% in the older population. So what we're doing is we're providing all of the educational content and the educational methodology, and I'll tell you how we use AI to do this because it's all personalized training. We're creating the tools that caregivers need on a day-to-day basis, so that may be mobile phone-based monitoring tools, automated notifications. We create all the tools necessary to communicate all of the stakeholders. So instead of caregivers being left to their own devices, they're, thanks to the platform, connected to a medical team, connected to the family members of the patient they're taking care of, connected to a caregiving agency or nursing agency or whatever organization they work for. And and these simple tools, well, some are not so simple anymore with the advent of AI. We've noticed that caregivers have to work, it's a more relaxed work environment. People can recognize their value and pay them better. And also by including all of the circle of care in the decision-making process and in the activity list, we are making caregiver a communal effort and not just something left to, I insist, the younger woman in the family. So let's talk about the components of the platform. As I said, a lot of the platform is based on training, certification, and support. So training is very well explained. Every time we looked at how caregivers were trained, it required, 60 hours of training in a hospital or in an elder home. And the reality of urban life in Latin America makes it difficult for people to really take 4 hours off of their time 3 times a week and go to a designated place and learn about caregiving. And also the reality of young people and all of us today is that our attention spans have decreased. And instead of fighting against this, we created a learning method that's based on micro modules. So like little 15-minute learning sessions followed by an exam with additional documentation and multimedia documents. And we're creating caregivers that can learn everything they need to know whenever they have 15 minutes of free time a day. So we create reminders and we see the interest and we understand the patients they're working with. And so we suggest what their learning route should be. So we've created over, I think, 400 micro modules. And these micro modules encompass everything from very basic things like even like taking a patient's temperature reading or um, what do you call it? Blood pressure meeting, all the way up to how to clean a gastrointestinal tube. So it really encompasses everything. Some patients, caregivers may have 10 years experience, but their patient had never had COVID, and now they need to learn how to manage an oxygen tank. Or their patients had a full mobility, they can't walk very well, so they need to learn how to lift the patient, how to mobilize the patient, how to bathe the patient in bed. So there are a million situations that a caregiver faces every day, and we provide all of the content and guidance that the caregivers will need. Secondly is the certification, and the certification, it becomes very important in our goal of creating well-paid jobs. And so we're creating different certifications in every country because sadly the world is still a bureaucratic mess and we don't have a recognized international certification for caregivers, but we're working on that. But we've noticed, and because we license our software to a lot of nursing agencies, we know that caregivers that have an official certification from the country get better salaries than caregivers who don't. So certification is an essential part of what we do, and we've registered amazing impact. On average, certified caregivers receive a 50% increase in their daily wages. And so this has become an essential part of what we do. And finally, it's the caregiver support. Now, caregivers faced a tremendous emotional burden. Caregiver collapse, burnout, is extremely common. And in the cases where caregiving is done by a family member, you could even argue that the caregiver is more at risk of collapse than the patient they're caring for. And so we've created, we did an AI agent where we trained the AI agent to lead meditations, a lot of exercises that can deal with excessive stress. But also what the AI mentor does is help them create a career path. So an issue with caregivers is that they feel that caregiving is a dead end. I'm going to be doing this the rest of my life. I'm going to be sitting next to a patient with Alzheimer's, not talking to anyone, alone in a room. And this creates, a lot of anxiety and a lot of detachment from their work. And over the past 10 years, we've learned what a career path can look like for a caregiver. So a caregiver can become a coordinator in a home hospitalization setting. They can become a service manager. And we've actually proven this over the past 10 years. Everyone who works in our company started off as a caregiver. And I'm talking about coordinators, managers, area directors. And it's all being done through training and emotional support. Secondly, I was mentioning how the necessary tools to provide proper caregiving. So health monitoring, and this is another place where AI comes in, is a decision support system. So we're very careful not to go into medical recommendations, but caregiving recommendations are different. So a caregiver will talk to the AI agent and explain what their situation is. You know, my patient is complaining of backache. So what is your patient's situation? Well, my patient has Parkinson's. What medications does it take? It takes this medication. Instead of making recommendations, health recommendations, say, why don't you look at this video, and it might give you a better perspective of what your patient is going through. And remember to check their blood pressure 4 times a day if your patient is over 80 years old and is presenting this kind of symptoms. So the platform kind of guides them as to how to do better caregiving activities, and it also connects them through teleassistance with doctors. So we have certified doctors that will guide a caregiver whenever they detect that the situation surpasses what a caregiver can do at home. But you know, we've tracked over the past 7 years that we've had the platform. We started with the platform in our own caregiving agency before we started licensing it to other organizations in Latin America. But we've tracked 100,000 medical notifications that led to preventable hospitalizations. So 100,000 times the platform has let caregivers know that the situation that they're reporting on could become a medical emergency, and we estimate that 30% of those could have led to hospitalizations. So we're very proud of the work that the platform is doing. And of course, as AI progresses, the platform, the algorithms become more and more sophisticated. If we could go to the next slide. Well, that's it for now. Dena was saying how we've reached 15,000 caregivers, and she made it sound like a big milestone. But you know, we want to reach 15 million caregivers throughout the world. So our work has just only begun. And you know, what we think is a sophisticated platform now, I'm sure will look extremely rudimentary in the next couple of years. So, you know, investing in making our technology more sophisticated, and more sophisticated, more user-friendly, I would argue, is our main goal over the next couple of years.
Well, Manuel, that is the perfect transition to my question, actually, which is we're all entrepreneurs, which means we're never done, right? And I can talk about how at Crisis Text Line we use AI for triage and for training our volunteers and to make sure that we get the most out of our research and create like world-class research products that can influence the system, but we're always looking at what else we can do, right? How do we utilize AI to evaluate quality and give our volunteers superpowers? I can have my list of what we will do next is so much longer than the list of what we will do. And so let me hand that to you first, and then I'll hand it over to you, Francois, to say, like, you guys talked a lot about what you're already doing. Can you talk a little bit about your aspirations for doing even more with AI?
Yeah. I mean, I'm gonna turn that question on its head before I give you a straight answer, and say that in technology in Latin America, developing countries in general, there's usually a tension between wanting to make the technology do more and more sophisticated, and now with AI you can, and then realizing that in a lot of territories in Latin America, internet is still not, you know, ubiquitous. So we're facing this tension on how sophisticated we want to make it, or how much we want to create offline tools. I can think of Colombia in particular, where we have a lot of clients. They're always asking, wait, what can you do offline? Because, you know, a lot of the patients that we visit don't have internet in their homes. So so part of our work is kind of like solving this tension between making the we're always in these forums and we see the capabilities of AI and realizing like how fast do we really want to go, because the reality in the ground is that a lot of people are still don't have just the infrastructure is not there. And the other interesting tension that we have to deal with is, using all the data versus respecting all of the privacy of that data. So this is still like an ongoing debate. In some countries, there's a lot of protection for data, and I think it's counterproductive. Like I understand the need for privacy, but in some places it reaches a point where you say, there's all these tools, we could prevent all these hospitalizations, we could, have all this impact if we're able to analyze and share this data. But the tension between protecting data and using data for better outcomes is always there. So, where do we want to take it? The third tension is making an AI appear extremely human, especially AI agents I'm referring to, and like how much people want to believe that they're talking to a human and how much they want to know that they're talking to a non-human. So again, this tension between making the AI seem extremely real and then just being really open, make it sound a little robotic so they know that it's not really a human connection they're having is a third tension that I think that we're always dealing with.
Yeah.
But the place I want to take it, so we said our vision is making caregiving a place of human connection and empowerment and purpose. And I think where we want to take the platform is to a collaborative place. So AI, I think one of the fears that I have with AI is making people more siloed, because the interaction with AI feels like it can complete everything, and we want to make the work of caregiving more collaborative. So I think I was saying how one of the terrible historic injustices is leaving caregiving to probably a female in the family. And so making a platform that really creates a collaborative environment where everyone in the near circle of the family member that's become dependent participates. And so, creating a platform that really, really, really stimulates collaboration between everyone to make caregiving a communal effort. I think that's the place where I want to take the platform next.
That's the big goal, or one of your big goals. I love that. Francois, how about you? Where do you want to use AI specifically to continue to advance your model?
Yeah, in fact, I mentioned earlier during my presentation that we are pushing a cloud-based platform on used laptop. And once the people get access to, we want to make people realize that with a basic machine that we are pushing, they can create extraordinary software and whatever. My aim is to make access to the AI at large scale on the African continent. So we already have some project that we will kickstart very soon, and also to scale to use the AI to learn how to repair, use the AI how to reduce e-waste, which is a big issue globally, and how to manage and learn and build new thing with instead of throwing away. So let's say with what we are doing, we can some laptops that instead of throwing it away, using the AI to create new things, new innovative things. Like, let me show you if I can try to can show you something.
Visuals.
Let me show you. This is parts of I don't know if you can see it. A trophy,
there you go.
which is made of parts of laptops, So this is a trophy that we give to those who are to support the initiative. So using the AI to create new things that we are not imagining now. So let's keep creating new ways of managing the e-waste. Yeah.
And so you're really looking at AI at two levels. One is the workforce development, or three levels. One is workforce development and skill development, and the other is making AI largely accessible across Africa, so more and more people can create innovative solutions.
Exactly.
Yeah, love that. One of the things that I think is really common between our three models is using AI to enhance and empower people rather than replace people, right? So when we have people texting in to us, people in moments of emotional or mental health crisis, one of the number one, because they're doing everything by text or by chat or by WhatsApp, one of the number one questions we get is, are you real? Right? They want to know if they're being connected to a bot or if they're being connected to a human. And my answer is always like, there are and there will be mental health bots, and that will be great, especially for some people that don't have access, and that's awesome. But we, Crisis Text Line, believe really, really strongly in the power of connecting humans and know that the benefit is on both sides, the texter and the volunteer together, to be peers and support. And so we look at AI around how do we improve that connection, make it faster, make it more efficient, help to triage, make people safer, help to do coaching so that that connection is even more powerful and the support is even more effective. Can you two talk a little bit about either your models or other models that you see, that what you think, how you think about AI and using AI to enhance and empower and enhance decision making rather than replacing people in the social impact space?
I get a lot of peace from this question because I know that AI creates a lot of anxiety over like job loss. Caregiving in particular, I think everyone can agree will never be replaced by AI because it's actually something a human needs to do. Whether it be, very things like changing diapers, lifting someone, helping someone eat. But AI does create the potential of making this job seem a lot more productive. Not seem, actually, to make the job a lot more productive in terms of, economic benefits. So, for a healthcare system, training caregivers and empowering caregivers with the right tools is a much better investment than building hospitals and creating all these like post-prevention solutions. So I, I think a lot of governments have begun to realize this. And something that seemed impossible when I started in this industry 10 years ago, which was like government subsidizing caregiving, is actually now becoming more and more common, even in countries that are not very rich, because it's just an investment that's been proven over and over that makes sense. And I think part of the reason that this is possible is again because of AI and the tools that this provides caregivers to make them much more productive, a much more productive workforce. The caregivers, like it used to be synonym of companions, like someone who's there just making sure that the patient is not alone. And now caregivers are seen, as I mentioned at the beginning, as a vital pillar in the caregiving systems. So I think we're very excited to be in a place where AI is not gonna take jobs away. It's actually gonna create better paid jobs.
Part of what I love that you just talked about is not just the specifics of your model, but proving your model to then influence how governments and agencies are actually spending their money, right? Put some money into the care that can happen at home rather than just the like intense hospitals that are not needed for all the care. I love that. Francois, any thoughts on AI for decision making and empowering instead of replacing?
In fact, I said I'm in the web industry, multimedia since the early 90s, before Google and so on, before the internet. We took a lot of time to learn something, and industry were there for long. So the people have time to learn an industry and to go to universities, to school. Nowadays with AI, the opportunity is massive. It is bringing, it is breaking the inequality, men and women. Now that we are talking now, there's a lot of things happening in the AI. Those who are tapping in the industry, new things now can create massive opportunity. It's a new way of getting opportunities instead of the old way of finding opportunities. And I think this morning I was looking at this book, 20 hours, I don't know if you see it, 20 hours to learn something. And so if you can learn fast in this industry, you can create massive opportunity. And this will break the inequality between women and men and age. So if you can tap into how you can capture the opportunities, let's say what will be replaced is the old formula. It's an old way of doing things, and with new way of doing things, and with a machine, a laptop that it was previously a waste, can be a super powerful machine that creates opportunities for everyone, especially in the African communities, where sometimes they don't have access to a mobile phone. So we can reduce massive e-waste, because there's massive e-waste around the world and they're producing. And just imagine now we can empower each and every and the program, medical program, the healthcare that our friend here is talking about. So let's say he wants to expand the training program, on a large scale. So sometimes some healthcare, they don't have access to technology, laptops to learning, because it is good to learn on the phone, but it's not practical to attend in the video call and to chat, to write, and so on. So just imagine how this combination can be not just for, this is one thing. This is one showcase example, but just imagine how big this can be done and how big the opportunity can be. I think, I hope I answered to your question.
Yeah, so like really first of all, seize the moment right now, and use AI to make sure that we're eliminating some of the efficiencies and opening up new opportunities for people, not just with phones, but also with computers, and reusing what we have, every unit of effort and every resource available to us to make it more effective and efficient. Appreciate that.
And
So
also,
go for it.
What very important also to the inequality that people say men are more powerful than, I mean, men, okay, but more men than women. So we break how we can bring the same equality if women can tap into the technology and create the opportunity. And this is massive. You don't, if you can automatic, how we call automate, you can automate the process, so the women can be working, taking care of the family, and the business is running automatically, and create new opportunities and create business while she's doing other things. So this is a new way of doing things, and at super speed. You just, I was preparing the slides because I was so busy, I just prepared this evening. So with the power of AI, I prepare it in less than 10 minutes. So
yeah,
it's so
using AI to make yourself more efficient and create your presentations. I appreciate that.
Exactly. So go on. So yeah, that's why this is one tiny thing. Each time I switch off my email, switch off all my tools here, as if you don't need to sleep. There's this acronym called FOMO, fear of missing out. So there's a new thing. Yeah, so if you sleep and you wake up, so you are outdated. You wake up updated, and you sleep updated, or you wake up outdated, because overnight things are changing. Yeah.
Yeah, we may have to lean on some of the materials that Manuel's developed to help with our stress levels. I can share some of those too. So I understand that Amara, you have a question. Could you go ahead and ask it?
Oh, yes, yes, absolutely. I hope you can hear me. I was actually putting this on my Bluetooth speaker so that I can hear everything about it. I am Amara Chineme. I hope you can hear me. Nod if you can.
We
Okay,
can.
great. Awesome. So I'm based in Nairobi, Kenya, and I run two particular one business and one organization. So for Empower Her Venture, I usually cater to women and children with disability. And these particular women are caregivers to these children with disability. And with JoyMed Healthcare, I do healthcare supply of products and everything that has to do with last mile delivery.
Mhm.
So my question is actually for integrating AI. I wanted to ask through Empower Her Venture and my work with healthcare supply, we support caregivers and we also support underserved communities by providing essential resources and sustainable solutions. So how can we ensure that AI-driven innovation help to enhance the caregiving support and deliver vital information to those with little to no access to smartphones or digital literacy? Because some of them literally even speak vernacular and you can't really get to be able to have that conversation with them. And I did also have another question about the families. I have been a caregiver myself to my grandmother, God rest her soul. And a lot more of people within the Africa setup rely on relatives to be the primary caregivers. And some of them have little to no training of formal digital literacy or any type of training within healthcare. So can the AI program expand to African countries to support us as caregivers with accessible and low-tech solutions? And how can we collaborate with you so that we can bridge this gap effectively? Thank you.
Yeah, it's a tough question that you're asking, and I think it goes again to the tension I was referring to, where like part of us wants to make everything AI because it's so much faster and you can personalize things and they can understand the context better. But the reality on the ground is that, a lot of people are, technologically literate, or simply they don't have the cell phones or the infrastructure or what is needed. So, I know this might be a surprising answer for a forum like this, but I mean, I've come to it, not everything is AI, right? So like maybe the ideal solution to a potential challenge that is faced somewhere is not necessarily AI. Um, I was giving the example of Colombia, but I think that this might apply as well. Like they loved the platform in Colombia and everything it did, but it said it just simply does not solve the reality on the ground for a lot of the territory that we cover. And so we, to finish how we solved that tension, we did end up developing a lot of offline solutions for caregivers in territories in Colombia where just data infrastructure was not there. So I
Yeah.
think for a situation what you're referring to, like I think it more relates to like more than AI, just very, very, very simple UX, like user experiences where people are not used to dealing with technology, and we've made a lot of efforts because the government program that we did with the Mexico City government was not for caregivers, was for older adults caring for themselves. And so we had to create, an interface that someone that is very technologically literate could immediately understand. And I think like the situation you're describing, that's what's needed. Very, very good UX design that with very simple devices and very low data input can create a lot of impact. Um,
And possibly voice to text or text to voice technologies that can exist on phones may be helpful as well. Those
that might be.
continue to get better over time.
That's true. That's true. That's true, Dina. That is one example where like AI can be simple, but I'm very worried that like, or very not worried, just very aware of like low data connectivity regions. And so that's why we created like fully offline solutions. And you know, we've translated that to a number of languages, but it's something that we could discuss in collaborating with, because yeah, I realized that you know, this session today is about AI, but really the answer is AI does not necessarily solve all of the issues on the ground.
Well, so there's two things here that I'm gonna take away, and then I think we have to go to small group breakouts really quickly. But one is, I love that you say that there's a lot of focus on AI, very exciting. Sometimes the right solution is an Excel spreadsheet. Sometimes the right solution is something much simpler. Like, we all need to, like, what's the problem and how do we match that? And sometimes it's AI and sometimes it's something simpler. Especially now that we're looking at generative AI, which is an even more advanced form with neural networks, etc. Not always generative AI. But also, this is what Catalyst is for, is the collaboration. And I know we have interest in getting to be able to support folks on the ground in Africa, whether it's through direct or through learning or through direct partnership or through learning. My hope is that this just kicks off a conversation, right? And that there will be many opportunities to collaborate. Debbie, should we go into small groups really quickly?
Yeah.
So
The small groups are set up is that you'll have the opportunity to go in a small group, and each of the speakers will be in one of those rooms. So that's lovely. The question here is, you got to introduce yourself super quickly, because what we'd love to have the conversation to kind of center around, is about AI and how, you know, you've experienced AI or AI innovation, how it's made an impact for you, you know, and then also the question about how can we make sure that it's inclusive and benefits everyone, that it doesn't hurt. But I think that first question about how AI innovations has made an impact, it'd be great to have a lovely little small group discussion in there. I'm launching the rooms now, so you'll go straight to room. If you're multitasking, feel free to stay in the main room, but otherwise join into your breakout room for a discussion, and then we'll come back and close out and have some follow-up things. Thank you so much. Perfect. All right.
That was very short.
I know, right? It's way too short. We could all just keep talking forever here. And I think like there's so much value, as always, in the individuals in the room. Can folks share a couple things that came up for them in the group? We had a small enough group of us, just 12 folks left. So it'll be good to get some insights from folks that were not the speakers. I'm going to call on people randomly if somebody doesn't raise their hand. Anna, do you have anything to share?
Yeah, sure. So in our small group, we basically covered the question on what's the business model of AnaCare, and well, he discussed the three lines on how they are doing the business model nowadays through caregiving agencies, through independent care providers, not providers, but like the independent individuals, and then local administration kind of model, and it was very, very interesting to understand, and it all makes sense. That I really enjoyed learning that how was the sentence that you said, that the pressure should be not on the payer, but that you providing more and more services, right? Something.
Yeah, that
To evolve the business model.
Yeah, we made sure that all of the license fees are on a month-to-month basis, and that puts the pressure on us to provide constant value to our users.
Love that. Anyone else want to share what was discussed in your group? Or even if you didn't get a chance to share it in your group, to share it now. Ingrid?
So
we were with François, and it was a really nice perspective about you know, how you get to do things with the AI and where it's gonna go next. But I had a question because of inclusivity. I am in Douala, Cameroon, in Central Africa, and a lot of our youth, a lot of our people are just learning about AI. You know, it's not something that they have been using or they are comfortable with. And I was asking, how do we make them feel inclusive? Because there's gonna be a gap. Somebody not speaking the English or French, you know, and then you have this new thing and you are trying to get them there. So how do we make them inclusive? Because we were also talking about from AI just in communication, it's gonna be linked to robotics. And I'm like, wow, that's even bigger. So yes, that's kind of yeah, a little bit of what we shared.
Yeah, thank you,
Thank you.
Ingrid. Let's see, oh, go for it.
Yeah, I think from our room, what I liked is, you know, we're all using AI in different ways. And if you see Arsen's photo, that was AI generated and it's super cool. And I'm going to go make one myself. But we were talking about how we're using it in our own context. But and how important it is, you know, to get all that information in a short amount of time. It's just so nice. But then making sure that it's, you know, accurate information and it's available. I did put in the chat, there's a report on how social entrepreneurs are using AI from the World Economic Forum and some AI tools. In our first session, we did a lot of like hands-on use of AI. So I put that in as well.
Oh, those are great, Debbie. And anything else anybody wants to share that came up for them?
In fact, I was sharing, François Mark here. I was just sharing that AI is good, but it's for the time being, it's virtual. So in the very, very near future, with the arrival of robotics, the AI will be another level of interaction. We're talking how we can make it inclusive, and in areas where there's challenges where there's no internet connection and so on. This will be in a very near future no more an issue, because companies like NVIDIA is already working on super powerful computer that works offline. You can put your AI model on the machine and work offline. So for me, it's no more an issue. In a very, very near future, when the robotics will be more sophisticated, and it can be used in healthcare, in talk in any language, interact, and this can solve many, many problems, I think, that because there's a lot of development happening at the moment in this area also. Yeah.
Love that. So I think that really at this point, the challenge is that we could keep talking for ages about what's possible and how we need to balance ethics and how we need to balance on and offline. And that was a great example, Francois, of what challenges we have today that will get easier and easier, you know, with the evolution of technology. But there will still be elements to access that we will still have to work through. So when I think about what we talked about today, I'm just going to do kind of a quick summary of how we have really talked about the evolving technology landscape and the access to cutting edge AI, which really is no longer reserved for high-end expensive systems, is available to increasingly more and more people, but we are constantly going to have to balance that on and offline and that access to have as much equity as possible, and to really do so thinking about ethics, which we talked about a little bit in our group, but didn't talk as the large group. And I think we just scratched the surface with our kind of 3 organizations and how we're utilizing AI. And my hope is, or I'm grateful to be part of this Catalyst network with all of you as we can continue to share resources. Thank you, Debbie, for those links, and we can continue to share ideas with each other so that we can take our innovations and spread them out to the world together. So with that, Debbie, where
Yeah.
should we do the poll?
Yes, we'll launch the poll here. We love to do the poll here because we like to get that feedback. We give it to our speakers, so feel free to fill out the very short 2-question poll that we'd like to share. Of course, that's assuming I am finding the poll because I'm looking at my screen and talking. And then also so as you're filling out the poll, there are some upcoming sessions that we have planned. We have a wonderful series that we're finishing up on social entrepreneurship, kind of the foundations. But we have 3 speakers coming in on empowering change makers and how change makers can influence the social ventures that you're working on. How do we work on our inner development? How do we help they handle the resilience that we need in the future? So that session will be coming up, and I can probably share my slides as well if you want to see the pretty slides. Then we also have, in addition to that, we have a systems change session that's coming up, which we're excited about. And that systems change, there's actually a new book that's coming out by the authors. So you'll hear from Danielle Pepe Thornton, who has her own business, and then also James Staunch as well. And they will talk about understanding systems for lasting impact and have some of the materials that's available from their book, and that's on April 10th. Lastly, the fundraising masterclass series, if you've been seeing those happening, we are finishing up. We have 2 different series going on right now. We have one that's with Black Fox Philanthropy, and the beauty of that is all our sessions are on our Catalyst Now YouTube channel, so you can see those sessions as well. And then we have an upcoming session on April 9th for social entrepreneurs on Know Your Organization and Know Your Board. So hope you can join that session. And that's it for us. In true Catalyst fashion, we love to thank our speakers for joining us and send you off on your day. As you say goodbye, say it in your native language. And thank you once again, Francois, for your enthusiastic information, putting Mauritius on the map. Also, thank you, Dena, for being a fantastic moderator, and Manuel for talking about your organization and how you're using AI. So unmute, say goodbye, and everyone have a good evening, morning, or afternoon.
Bye, everybody. Thank you.
Bye-bye, au revoir. Thank you, bye-bye. Thank you.
Adios.
Thank you, Dena. Bye.
Gracias. Thank you both all.